During the first 2 weeks, patients should practice walking with a space walker to avoid putting too much pressure on their knees and to prevent from slipping. The next video uses a walker or a full-legged walker to practice sitting up, walking, going to the restroom, and going up and down the stairs for those who have undergone knee replacement surgery. Sitting up. While sitting down, move towards the front. Stretch out the surgical leg. Use both hands to hold the full-legged walker. Move toward the front, stretch the surgical leg, and put the weight bearing on the non-surgical leg to stand up. Once you are up, move your surgical leg to a normal standing position by taking a weight as much as the surgical leg can handle. Walking. Move forward a bit with the full-legged walker. Raise your body forward within the full-legged walker. Step forward with the surgical leg and move the non-surgical leg to the same position. In going up and down the stairs. In going upstairs, use the non-surgical leg first and follow with the surgical leg. In going down the stairs, use the surgical leg first and follow with non-surgical leg. In using the restroom. In sitting on the toilet seat, step backward with the non-surgical leg first and follow with the surgical leg until both legs touch the toilet. Then raise the surgical leg towards and reduce the weight on the surgical side while gradually sitting down. In getting up from the toilet seat, raise the surgical leg up while both hands holding the full-legged walker and transfer the weight to the non-surgical leg, gradually in moving forward. Therefore, you will find that such regular knee movement exercise can help preventing such aging process as osteoarthritis condition. You will be well on your path to having a well-being way of life. Best wishes from Jomtien Hospital.